Hey folks, Dr. Timothy Harcourt. We're going to go over the top 3 things that you want to ask before getting surgery. In case we haven't met, Dr. Timothy Harcourt, I'm board certified in neuromusculoskeletal medicine, practicing 33 years. I come from a family of medical doctors, surgeons, and chiropractors. So tag somebody in the comments. Send this to somebody who's considering neck or back surgery so that they're, have something to look at before they get their surgery. And then let me know how you're watching this video, if it's on YouTube, if it's on Facebook Live, on a rebroadcast, could be listening to it on SoundCloud. We'd love, because you can put it in the comments on those. And then the next thing is this a topic of interest to you? So we're going to go over the top 3 things to always ask your surgeon before you get surgery. Before we do that, we're going to just place the background. So the background is that I started practice in 1987. The surgical rate for back pain patients is different than what it was when I first started practicing. In fact, it's much higher. And this was just kind of a thought I had, but I went online to see what research says. There is a wonderful article done in the British Medical Journal by Grotto et al., which goes over the fact that in a 15-year time period between 1999 and 2013, there was a 54% increase in surgical rate for patients with lower back pain. And for those people over the age of 75, it was a 5-factor increase, which is substantial. So one would have to ask the question, and one of the things that Grotto et al. Mentioned is that the rate of surgical intervention increased at a much higher rate than the actual rate of spinal conditions. What that really means in short terms or in easy terms is that surgery has increased faster than spinal affliction. So the question is, why would that be? And so therefore, we're going to go over some questions to ask before you get to surgery. Now, you may need the surgery. We're not saying that, but there are some questions you might want to ask before you actually get your surgery. Fortunately, a really low percentage of lower back pain patients require surgical intervention. In fact, much less than 1%. The good news is that 99% of people with lower back pain respond in a non-surgical intervention. So, such as neuromusculoskeletal medicine is what we do here. Now, one of the things that you want to always be concerned about before we get to the top 3 questions is what's going to happen after your surgery. Are they going to prescribe opioids for you? I don't know if you're aware of it, but in the state of Florida, the Florida Department of Health made it a mandate for your doctor to offer alternatives to opioid medications for back pain. So one of the things you want to be concerned about in asking questions, we'll get into the questions in just a second, would have to do what happens after the surgery. But I'm talking about the questions before surgery. So why would that be important? Well, if they plan on getting you on opioids in your recovery, what is that looking for you in the future? By the way, if you want to look it up, it's Florida Statute 45644, Section 7, as to where that mandate is. And the thing is, why is that important? Because if you decide to have the surgery, it'd be nice to know how they're going to handle your recovery. But let's get into the top 3 questions you want to ask before getting surgery, regardless of what the surgery is. Number 1. Have you exhausted all other conservative remedies? I mean, before we go to the surgical remedy, and let's just face it, not all surgeries are successful. And so therefore, have we explored other remedies first? In fact, have we explored remedies that have been recommended by the Florida Department of Health? Have we, gotten past all those remedies before we consider the surgery? And do you subscribe to the guideline of at least 6 weeks of unresponsive conservative care prior to doing my surgery? Now that's for back pain. If you have for something else, the surgical guideline might be different. Number 2, what outcome do you foresee in my case? Like, what are my percentages? Is this 50-50? Is it 40-60? Is it 10-90? What's the perceived outcome here? And how do you feel about doing surgery on me? I mean, how do you feel about it? And then the last and most important question you can possibly ask anytime before you ever have surgery is, Doc, if you were me, would you do surgery on yourself? And if the answer is unequivocally yes immediately, then you have your answer. If the answer is anything but that, you may want to seriously consider that. It's always between you and your surgeon. However, these are excellent questions to ask before having your surgery. Now, should you desire to have a non-surgical, non-opioid physical medicine approach prior to having surgical resection within your back or your neck, listen further to see how we could possibly help you. We really appreciate you watching this video. It's Dr. Harcourt wishing that you stay strong, stay healthy, and stay creative. Know you need to go in a different direction? Call and we'll have a sit-down, no-charge consultation.
Thank you so much for watching. Please remember to like this video and subscribe to our YouTube channel. Also, check us out on Facebook and Instagram. Links are down below.